Dr. Raul Rodriguez is back, and he will tell us more about mesotherapy and how it can help diminish cellulite. And especially women, we know what that is. I know, look at that needle. Oh. But hey, I'm sure there's no pain there. There's, you know.
I'm sure he numbs everything first.
There you go.
But you know what? It involves minerals and vitamins.
Which is, yes.
That are injected into they don't really go deep. It's just the top layers almost, and they prick the skin with these different things, and it helps it go away.
This is non-invasive. When you think about so many people who undergo like liposuction and all those type of things, and that. So this is a non-invasive procedure and very popular now. And so we're glad that we have this doctor here in North Texas that can tell you all about it. So we'll get more from Dr. Raul Rodriguez later.
Smoothing over cellulite. Coming up, a look at mesotherapy and how it's helping patients minimize cellulite without surgery.
And we will meet the owner of Sweet Joy.
Okay, let's talk about feeling better. Can you get rid of this, by the way? Maybe?
Actually, we can shrink it.
You can shrink it? Oh, cool. Liposuction is one of the most popular cosmetic surgeries today in the battle against stubborn fat. However, a growing number of people are opting for another way to smooth out dimpling caused by cellulite or cellulite, depending on where you're from. They are choosing to have doctors inject a cocktail of chemicals into problem areas. The technique is called mesotherapy. Dr. Raul Rodriguez is back to tell us more about that. Good morning, doctor.
Good morning,
Nice to have you with us. So what can you do? Let's don't talk about mesotherapy. Let's talk about me. What can you? No, I'm kidding. Tell me what mesotherapy is.
Well, mesotherapy is an injection technique that started, at least was popularized in France in about 1950 or so. It involves injecting small amounts of medications directly into problem areas to change the tissues in that area. And cosmetic applications, primarily to tone and tighten skin, to reduce localized fat deposits. It's a non-surgical alternative to liposuction.
Ooh, yes.
And as we were talking about, to reduce cellulite.
You see that? Thank you for saying cellulite. Doctor said, by the way, that's why they taught it in school, is cellulite. Tell us what this chart shows.
Now that chart shows the skin being tethered down by these fibrous bands. Many people think that cellulite or cellulite is just a problem with fat, but it's a problem with connective tissue kind of tethering down the skin, causing a mattress button effect.
Yeah, because it pulls it down.
Exactly, and that causes a ripply appearance on the surface. By injecting certain medications that break up the fibrous tissue, we can actually get the skin to come back to a more normal, smoother contour, thereby reducing or eliminating cellulite.
So it's, instead of, you're putting stuff in, not taking stuff out.
Absolutely. We're actually putting medications into the tissues to cause changes in the tissues that are long-standing changes.
Okay, now we talk about injections and needle injections. How many injections are there? I guess it depends on the amount of cellulite, right?
Well, of course, it depends on the body area, how much of a problem we have to deal with. The injections are little tiny needles. I mean, you barely feel them. The injections go directly under the skin, right where the skin is being tethered.
And we're looking at some video now. Do you anesthetize the top part of the skin, or can you feel it, or are you just so good that you can't feel it?
Well, both.
That's good.
But actually, I do use a topical anesthetic, it makes the procedure virtually painless. You don't feel the needles at all, Scott.
Okay, and how long does it take to do this?
The average session takes anywhere from about 30 minutes to 45 minutes, depending on how much we need to treat.
Who's a good candidate?
Anybody's really a good candidate. The medications are very safe when administered properly by a properly trained surgeon, and but really there are no exclusions depending on the age, race, size. Anybody's a fair candidate. It's just a matter of adjusting the medications appropriately for the patient.
Let's look at the other side of that. Who's not a good candidate?
Probably somebody that doesn't have cellulite. But
good point.
It's a very common problem, very common condition, but most people don't realize that now there is something that you can do to permanently change the appearance of cellulite.
I mean, it permanently changes it? This isn't a thing where you go in and get some shots and 6 months later you need shots again?
Well, not necessarily. I do advocate that people have like a tune-up 6 months later to maintain.
Well, that's
we
a good
always
idea.
know that maintenance is a lot easier than repair.
Sure.
So, but we're causing actually changes in the structure of the connective tissue under the skin. So these are long-standing changes, not just temporary changes that are going to look good for a couple of days.
Wow. There are places on a person's body that liposuction is typically done, the back of the arm and stuff like that. Can mesotherapy do the same kind of thing?
Well, absolutely. Mesotherapy is great because if you have some unwanted fat deposits or some ripply skin that we call cellulite, it's a good way to reduce the fat deposits or improve the appearance without leading to subsequent scarring or rippling that you can have after liposuction. About half of my patients are patients that have actually had liposuction before and now have an uneven skin texture, and I can fix that with the cellulite treatment.
That's amazing.
Right.
It's amazing that it can be done. Okay, we have some pictures. We want to show you a before and after, and then, doctor, you can tell us about what we have before on the left, after on the right. There's quite a bit of change there.
This particular lady had a very common problem. Cellulite dimples are very common in the buttock area, and you can see before on the left-hand side, very prominent, and then after. And Scott, by the way, this is a time to get it treated because we don't cause changes in the body overnight. So if people want to get in shape for the swimsuit season, now's the time to actually get started because the process takes 2 or 3 months to accomplish.
It does take 2 or 3 months,
yes, sir.
But it gets rid of those little fibers that pull the skin down.
Exactly.
I think that's amazing.
Absolutely.
Here's some more before and after.
Right, and this particular lady had 2 problems. You can see that actually this is a patient that had liposuction before, and you can see a significant improvement from the left to the right-hand side. And we also were able to reduce some of the bulges that are right on the upper edge of the before picture.
Yeah, I see
and
that.
made those areas right where you see the panty line decrease. We made those bulges go down with the medication. You can see they almost carved those away, in addition to treating the cellulite.
Okay. 2 questions immediately come to mind.
Right.
One is how much does it cost?
The average treatment runs about $350 to $500 depending on the area. And patients may have anywhere from 5 to 10 treatments depending on how much of a problem they have.
And that's a cost per treatment?
Cost per treatment.
Okay.
And
now, a lot of folks are going to ask, is it covered by insurance?
Well, insurance doesn't care how pretty your skin is or how pretty you are. So, no, this is purely a cosmetic procedure, and it's not covered by insurance.
But it's a pretty amazing cosmetic procedure because it's non-invasive. I mean,
it's non-invasive.
It's non-invasive. You don't go in there and you're not sucking all that stuff out of there. And
no pain. People go back to work, go back to catch their tennis game, whatever they want to do. No interruption in your normal lifestyle. And that's a key because a lot of patients are looking for that nowadays in their cosmetic procedures.
Right. Bruising? Any kind of bruising?
You can expect to have some scattered bruising over the area that I'm treating. I mean, that's just par for the course. But the bruising goes away by itself. They're usually about thumbnail-sized bruises. They go away like any other little bruise in a matter of days or weeks.
Wow. So now is the time to do this if you're going to be out in, this summer with bathing suits and all that kind of stuff.
Absolutely. Now, this is not a quick fix. And patients always need to know that to cause changes in the body, to cause changes in their tissues, they have to be patient.
Yeah.
And now's the time to get started so that we can cause those changes over the next few months, and they'll look fabulous for swimsuit season.
That's why they call them patients, because they have to be patient.
Well, that's why they should be patient. Because they're called patients.
Good point, good point. That's better. Well, you're much more educated than I am. Good for you. If you'd like to learn more about mesotherapy, you can check out his website at rejuvenexmedical.com. rejuvenexmedical.com, and tell everybody where you are.
I'm at Medical City.
Medical City.
Medical City.
Dallas.
Medical City, Dallas.
Doctor, thank you.
Okay,
this
my
is great
pleasure.
stuff. Nice to have you back.
Thank you.
You should stick around and have some of this food.
Oh, I'm planning to.
Okay,
I'm planning to.
Hey, Debbie.